Health. One common side effect of diabetes is the irreversible damage of limbs. News 4 San Antonio's Melissa Vega found many diabetics are turning to oxygen for help.
Maria Torres has been a type 2 diabetic for more than 2 decades. The disease was taking its toll.
I was in a lot of pain and was ready to give up.
Things got even worse.
The first group of doctors that were working with me in my left leg wanted to do an amputation.
But a second opinion changed her life.
I thanking God for this and answering my prayers.
For several months, Maria has been undergoing hyperbaric oxygen therapy at Nick's Health Wound Care and Hyperbaric Medicine Center downtown.
Every day, 5 days a week.
The treatment is done inside this hyperbaric chamber.
One of the largest for civilians in San Antonio. We're using oxygen as a medicine.
Patients like Maria go into the chamber filled with high pressurized oxygen for about 90 minutes.
That 100% oxygen is given at twice the atmospheric pressure. So you're getting around 10 times the dose of oxygen that you are getting right now.
Dr. Marshall Packard says the entire body is under pressure, the equivalent of being 33 feet underwater. That's why the process sometimes is referred to as a dive.
So I just take a nap for an hour and a half, and then the lights go on and it's just time to get up.
Maria's skin is not only healing, but she's going to keep her left leg.
Thank God for that.
Jesse Castro, a diabetic who had several toes amputated in the past, also turned to hyperbaric oxygen therapy. He says the treatment saved his foot.
No infections anymore, and it's almost healed up.
Some people call us an amputation prevention center.
It's not only about using oxygen as medicine, but treating the wounds to make sure they heal.
Once the circulation has been restored, then we take these patients to the operating room and do reconstructive surgery, and that is closure of a wound, either by primary closure or by applying a skin graft.
A dedicated team.
That's why we do what we do.
Giving diabetics back their quality of life.
I consider it a blessing.
Melissa Vega, News 4, San Antonio.
And doctors say this treatment is not for everyone, but if you are diabetic and possibly are facing an amputation, this might be an option for you. The treatment is covered by most insurance.
Now, your 4-Zone